Hello everybody, I am Dr. Harsha Kumar H N, working as a lead consultant nephrologist and transplant physician at Aster RV Hospital. Today I am going to talk a bit about what is chronic kidney disease. If you have to understand in a layman's language, is chronic kidney disease is any structural or functional abnormality in the kidney which affects its working of the kidney. So we divide chronic kidney disease basically into CKD stage 3A, 3B and 4 and last stage 5, which we defined as end stage renal disease. What are the common causes for chronic kidney disease? So as we all know that type 2 diabetes and hypertension, roughly about 60 to 70% of patients with chronic kidney disease have this problem. Other than that, about 20% of patients have something called as chronic glomerulonephritis, that is a disease in the kidney filters, and roughly around 10 to 15% patients have this chronic interstitial nephritis, that is what we call as defect in the interstitium and tubules of the kidney, and about 5% of the patients is because of obstructive cause, either in the form of the obstructive cause, that is because of the stones or because of the stricture or anything, that can also contribute to the chronic kidney disease. So how do you identify chronic kidney disease? Most of patients ask me. See, it's a very simple test, like we do something called a serum creatinine and we do an urine examination for microalbumin. These are the simple two tests which will help us to identify the chronic kidney disease, and we do a ultrasound to look for the kidney size. So if we find any microalbuminuria or increase in serum creatinine or any functional abnormality of the kidney like shrunken kidney, single kidney, malrotated kidney, abnormal, then they are classified as chronic kidney disease. So any patient who is detected as a chronic kidney disease at the earliest stage, okay, we can identify the cause, and if we manage them well, they will not progress to the end stage renal disease. How we can prevent the chronic kidney disease? So early identification is key. The second important thing is, if you are a diabetic, control your sugar. If you are hypertensive, you need to take your BP medicine, keep the blood pressure under check. Avoid unnecessary over the counter drugs like painkillers, Ayurvedic, homeopathic medicines. All these things have to be avoided. Okay. The next thing is, if you are a smoker, you should stop smoking. Okay. If you are obese, you need to restrict your carbohydrate intake. Weight reductions. If you take alcohol, then you should moderate your alcohol, and every year you should get your basic test like serum creatinine, urine for microalbuminuria, and also get an ultrasound if possible. Okay, if you have any of these features or symptoms, you can meet the nephrologist and take the opinion from them, so that we can prevent the progression of the disease and prevent you from going to the end stage renal disease. So if you have any of these queries regarding chronic kidney disease, resistant hypertension, or any other nephrology related queries, you can visit Aster RV Hospital, JP Nagar. I will be available daily for consultation from Monday to Saturday.